My name is Ted Epperly. I'm the Program Director and Chief Executive Officer of the Family Medicine Residency of Idaho. The FMRI was created in 1975 to meet the growing need of patient care in the Treasure Valley, as well as to produce an outstanding family physician workforce for the state of Idaho. We have three missions at the FMRI. Number one is to recruit outstanding medical students and train them to be superb family physicians. Number two is that we want to train them broadly, so that they can go into every sector of Idaho and serve our citizens with distinction. And our third mission is to serve the underserved. Our mission of education is core and integral to our program. Without education, we are just another clinic in the city of Boise. Education is at the heart of what we do. You will hear over the next several minutes, through the voices of our residents, our faculty, and our alumni, what the educational mission has meant to them.
The quality of the residents at FMRI is one of the things that really attracted me here. We bring in residents from across the country who have a varied set of skills they've developed through life. They come from some of the best medical schools in the country. And I think one of the things that draws them to FMRI is the opportunities available to them in Idaho. They really see the chance to go out and practice in a variety of settings in Idaho, from urban to some of the most remote rural settings that are possible.
I chose FMRI for my residency for a number of reasons, one of which is I grew up in Nampa, Idaho, and this is what I considered my home and where I wanted to practice and just continue to care for the community in which I grew up in. I also knew it was a great program with a good reputation and a lot of opportunities for excellent learning.
So I came to FMRI after a long journey that took me through rural medicine. I left residency and went to practice in a isolated Indian reservation down in New Mexico. I spent 6 years there as a family physician, giving broad spectrum care to very sick and very needy patients. We struggled with economic issues constantly, and we always felt a mission to serve the underserved there. One of the things I found out over that 6 years was that I had some talent as a teacher. I received feedback and felt a lot of energy when I was put in positions to teach medical students and visiting residents from around the country.
I think that my best educational experiences that I've endured thus far, number one, simply just being able to see patients, and lots of patients here at FMRI. Being able to see anywhere from 8 to 16 patients in one day in the clinic, to working with patients in the hospitals, and the numerous hospitals here in the Valley are just absolutely wonderful. But I think the educational experience that's been the most beneficial for me is traveling to different rural areas to learn more about how medicine is done in areas not associated with big hospitals, in areas where, quite honestly, things are a little bit more laid back and the humanity of medicine is a little bit more prevalent. So I've fortunately been able to go to areas such as Chalice, Idaho, as well as Bonners Ferry, Idaho, and try to be a doctor there. And it's probably made me think outside the box the most and grow the most as a doctor.
One of the most unrecognized and undervalued missions here at the Family Medicine Residency of Idaho is what service to patients we provide in our community. The FMRI provides comprehensive, continuous patient care to over 46,000 unique patient visits and over 17,000 unique patients. We provide over 1,000 obstetrical deliveries per year, over 1,000 medicine admissions to adult patients, and over 2,000 admissions to children and newborns. In our clinics, we have over 35 different languages spoken. Our graduates collectively, since the inception of our program, have seen over 18.3 million patient visits.
Types of patients that I've seen thus far in my 2 years in residency are quite diverse. I've had anything from what everybody would stereotype in Idaho as being your local farmer and rancher, to metropolitan-based men and women, business people. I've had the fortunate opportunity to work with some of the migrant workers that have come to this area, as well as refugees. And I've seen people that are extremely sick and relatively healthy that just have just unfortunate incidences in their health process. So it's quite diverse what we get to see here, and it's been very educational and very enjoyable as well to learn more about the humanity that we have in this world.
I chose family medicine as my career and my specialty in medicine because I wanted to be as useful to as many patients in my community as possible. I enjoy taking care of a wide diversity of patients, both with respect to disease and with respect to ethnicity, language, and it's just been really satisfying to take care of a broad range of people and mostly just be useful to my community.
I would say one of the most rewarding or heartwarming patient encounters I've had here involved a young Burmese woman who was pregnant and of course showed up at the end of clinic having difficulties, and after quite a bit of work we were able to get them figured out, and so I thought the patient spoke no English, but at the end of this long encounter the patient just looked at me and shook my hand and said, "Thank you very much."
The motto of our program at the Family Medicine Residency of Idaho is Train to Remain. Idaho faces a healthcare crisis. We rank 49th in the nation for the number of physicians per capita. We rank 47th in the nation for the number of primary care physicians per capita. We are the second oldest physician workforce of any state in the United States. We are extremely proud at the FMRI that we have graduated as of July 1st of 2009, 230 graduates from our program, of which 130 or 56% have stayed in Idaho. The key to helping our graduates stay in our state is that we train them in over 23 rural locations throughout the state. And the outcome of that is that we rank 8th in the United States for our ability to keep our graduates in our state.
So as I travel around the state of Idaho, I see many beautiful areas of the state, which I thoroughly enjoy. We have a very engaging medical community throughout the state of Idaho. Many family physicians who thoroughly enjoy what they're doing out in their communities and who are taking excellent care of the citizens of Idaho.
FMRI has and is an organization that has helped so many. The mission here is both to train the doctors for the future of Idaho, but also to care for the people who need it the most here in Boise and throughout the state of Idaho by being able to share our graduates with the rest of the state. So my hope is that there's really no one in the state that FMRI doesn't help.
The Family Medicine Residency of Idaho has influenced my career in many, many ways. The one I'd like to highlight is leadership. Boise is a small community. I was able to be a leader here at the residency as a chief resident, and that made me feel confident in doing things statewide and nationally ever since I've left the residency.
Now that you have heard from the voices of the outstanding residents, faculty, and alumni of the Family Medicine Residency of Idaho, you can see what the magic of this program is. It is a true gem for the state of Idaho. It is an asset that combines not only outstanding, compassionate patient care, but an educational mission that meets the growing workforce of family physicians in the state of Idaho. William Butler Yeats once wrote that education is not the filling of a bucket, but the lighting of a fire. Our job here is to light that fire in our graduates for the next 40 years.